So my name is Erin Parks, and I'm with Oklahoma Family Network. And if you don't know Oklahoma Family Network, we are an organization that is statewide that helps families with special needs and behavioral health challenges. So we offer these trainings. We do monthly mental health presentations like this that we will talk about later in our training. But I also want to introduce my wonderful coworker, Nancy. And Nancy is on here. Nancy, you want to say hello?
Yes, well, my name is Nancy Juarez. I'm working with Erin Parks on Oklahoma Family Network, and I am Hispanic Family Support Partner. And I just glad to be here.
Well, thank you, Nancy. And again, if you have questions this evening, you can put them in the chat or feel free to unmute yourself. I'm going to go ahead and share my screen. Can everybody see that okay? Okay, perfect. Nancy, if for some reason it messes up, just let me know. Okay, so what we're going to do this evening is we are going to talk just a little bit about what OFN does. Several of you on this call. Oh, wow. Sorry. Hold on just a second. Hold on. Sorry. Hold on. I don't know how this is. I apologize. Hold on. Stop sharing. Hold on. Hold on. I don't know. Can you hear that? Nancy, can you hear that?
I hear your voice. I don't hear any of from the presentation.
Okay.
Just hear
Okay.
your voice.
Okay. Okay. No problem. Okay. I apologize. So let me see. Let me get this situated. Okay. So I'm just going to make sure, guys, I'm going to do this real quick. And we are going to make sure that we are good to go. Okay. So what we are going to do, I am sorry about that. For some reason, it is not. Okay. So I'm going to go ahead and share my screen again. And I don't know why. Hold on. Sorry, guys. Just bear with me for just a second. For some reason, it's keeps going straight to the. Nancy, can you see that okay now? I don't know what it's
I
doing.
don't see your presentation.
Okay, you don't anymore. Okay, so I am going to see why it won't work. Okay, hold on just a minute. I hate it when these things happen. I hate technical difficulties. So hold on just a second. Okay, we're going to try this again. Okay,
Okay.
we will. Now we're good. Okay, perfect.
Yes.
Okay, here we go. I'm not going to press any more buttons. So I wanted to start off with when we talk about what OFN does. This is one of the things that we connect families to resources by providing that peer-to-peer support. And we provide that emotional support and resource navigation. You do not have to have a diagnosis to get help from OFN. It is something that you can simply text Nancy and I. You can email us. You can put a message on Facebook, however is most convenient for you, and we'll get back with you. So again, there's no charge. We don't take insurance. We are truly just a nonprofit that will help you and support you and your family wherever you're at. If you're a professional that's joining us, then we will help you. We can do trainings and we can guide the families that you serve. So that's a little bit about Oklahoma Family Network. So one of the things we do is when we help families in the NICU, neonatal intensive care unit. So if you have any families that you know that have a prenatal diagnosis or they're going to be in the intensive care unit, we are here to help them. We have staff that actually are. We have probably, I want to say 5. We have here in Oklahoma City, and we have here some in Tulsa. And what they do is they provide that support in the neonatal intensive care unit. And they have reunions, they have support groups. So a lot of people don't know that about Oklahoma Family Network, that we do offer that connection to those families. So one of the things we're going to talk about tonight is to find out there's 3 main levels. And when we think about that, there's national resources, there's state resources, and there's local resources. And we're going to talk about a lot of those this evening, and just kind of the difference between some of those organizations. Our executive director is Joni Bruce, and you'll see here she says, once we as families begin our journey of educating ourselves so we understand our child's or our disability or special healthcare need and the supports available to us, only then can we drive our own services versus waiting for someone else to tell us what is available. So again, think about that quote. That's really important on this community resource training, because we want you to know that there are resources out there, and we just have to, you don't know what you don't know. So that's hopefully by the end of tonight, you will have a few more resources in your toolbox, but always know that those are the three main levels that we're going to discuss. The first one, and I kind of feel like one of the most important ones, is this community guide in Oklahoma. And this is at the Center for Learning and Leadership's website. Here's the QR code that you can use to get to this resource guide. If you go to the Center for Learning and Leadership's website, it is phenomenal. It has so much information in there. They also have a book called the Alphabet Soup Book. This is an encyclopedia of disability-related terms, along with mental health-related terms. This has been very beneficial for me, even as a professional and in my family life, is to make sure that I knew what IEP versus 504 or an FSP or an IFSP, all of these terms. So many people throw acronyms at us. And a lot of times we as families, we don't want to ask what it means because we feel like maybe it'll make us not feel as important or make us feel less than. So that is why using this alphabet soup book can be really beneficial. And I want to make sure that you know that this book, with the community guide, it's across the lifespan. So it starts at early invention and it goes all the way through adulthood and the aging population. So again, wonderful, wonderful resource that I can't speak highly enough. It has Medicaid in there, it has respite, it has sooner care information. It's just a guide that can really help you and your family. The next one, this is just actually kind of a snapshot that shows in here about what it does. So it breaks it down into birth, age 3, and it talks about all of the disability resources. And on the other side, you can see it talks about whether there's an income limit, whether you have to meet certain criteria. So this is just a 2 pages that are inside of that disability community resource guide that you can look at. So this is just a snapshot. Another thing we want to talk about is we have so many areas with Oklahoma Human Services. It's split up into different categories. So across several of you I know are in different areas of the state. So if you look over here, this is area 1. You can see what counties are in area 1. You have area 2 and you have area 3. And this is just another resource that you can find out about different resources by calling the number on the left-hand side. I will send you this presentation, so just know you will get these slides along with the whole presentation. So that way you don't have to take some notes or worry about that this evening. So one of the things we're going to talk about with the Oklahoma Human Services is TEFRA. TEFRA, if you don't know what TEFRA is, and you have or you work with families that have disabilities, what it is basically, it is where the family itself, it's not based on the family's income, it's based on the child with the disability's income. So TEFRA was actually created because of the wait list. We'll talk here in a minute about the Developmental Disability Service Division, DDSD, in-home support waiver. And so for the people that are on the waiting list, they can qualify for TEFRA. There are some people that qualify for TEFRA, but they don't qualify for DDSD services. But what this does is TEFRA allows children who are eligible for institutional services to be cared for in their home. So all you have to do is, and I can send you the link and some information about TEFRA, but all you would have to do actually is just put in Oklahoma TEFRA, and all of the application and all of the information will come up to you. Another one is the SSI DCP. That is a program that provides services to children who receive SSI. You can use that income payment for adaptive equipment, lifts for vans, formula, professional services. So all you have to do is that's the Disabled Children's Program, and that is part of DHS. And so what you would do is you would contact your area 1, 2, or 3, depending on what county you live in, and you would ask for the Disabled Children's Program with OKDHS, and they can connect you to these services. So again, TEFRA can provide Medicaid services to children that have disabilities that maybe your family is over the income limit, but it will just look at the child's income. Okay, we're moving on. So this is the next one. The next one that we have, oops, sorry. The next one is the FSP. And sorry, I'm learning that if I touched a button, it doesn't work. So this is a cash payment. And if you look at this, this is a cash payment where if you're caring for a child who has a disability under the age of 18, you can actually receive a payment of $250 to $400 per month, depending on the number of children with disabilities in the home. So I will tell you, you cannot have in-home support and the family assistance plan. It's either or. So if you qualify for an in-home support waiver, you cannot get the family assistance plan. Okay, so I hope that kind of makes sense. It's kind of an either or type situation. But the in-home support, what that is that's the program I was telling you about called DDSD. And I'm just going to give you a little quick history about the DDSD services. The Oklahoma Developmental Disability Service Division, DDSD, they have a wait list. You probably heard that it used to be 13 years long. It was very frustrating. But about 2 years ago, our state received some funding and they actually eliminated the wait list. And they took all the people that were on that wait list and they started giving them services. But now the wait list is about a year long. It can be anywhere between 1 and 2 years. I just attended a meeting last week and they said it's less than a year. So if you have a child or know of a family that has a child that or an adult, there's no age limit. This is across the lifespan. So there's actually no age limit to this. But you need to get on the in-home support waiver waiting list. And what that does is that allows for additional services that insurance doesn't pay. It also can allow you, a caregiver or someone you know, be what they call an HTS, Habilitation Training Specialist. You as a caregiver can actually get paid for taking care of your loved one if they are in the home. And or you could have someone that you know. Maybe it's an aunt and uncle, it's a grandparent, or it's a neighbor, it's a friend that can come in and take care of your loved one that has a disability and they can actually get paid. You can also use this to be used for camps. You can use it for, I use mine for my daughter's horseback riding therapy. You can do it for swimming lessons, adaptive equipment. So this is very important to make sure that you or the families you serve know about this waiting list. You have to have an intellectual disability. It's not just physical disability. So a lot of times that is the difference. If you don't qualify, if your IQ is a little too high, then you might not qualify for this waiver. However, you might qualify for the family support plan. So I'm giving you a snapshot of a lot of different resources. And then after this meeting, you can reach out to Nancy and I, and we can help you figure out and give you more information about one of these resources that you want to find out more about. So if anybody has any questions about TEFRA, family support plan, or the in-home support waiver, please let me know. We can get you the application. We can get you the person to connect with directly to get on that waiting list. So one of the other things we talk about is we have these adult learning centers. I will be honest, I didn't even know about this learning center, the independent living centers and the adult day services. The adult day services actually has an entire provider directory. They include the Bill Weaver Daily Living Center. Some of them are the Baptist Home Care, the Urban League, Southside Daily Living Center, OKDHS. But if you go to Adult Day Services and you go to this website, there is an entire information sheet on the adult day services. And this can include individuals with disabilities that are young adults. So think about over the age of 18. Over the age of 18 is the adult day services. And that is a really, really good information provider directory. We also have the independent living centers, and these are the ones that are available in Oklahoma. Think of these more as group homes. Some of them are you can use the DDSD waiting list information. If you use the DDSD waiting, you can actually use that to get into some of these independent living centers. But the independent living centers, again, if you're interested in any of this or the group homes, these are the ones that are available in Oklahoma. Okay, so now we're going to move to the next one.
We
So we're
have
going to kind of, oh,
questions on the
yes.
chat. Kevin
Okay.
Jimenez said, if I have one child with a learning disabilities, can be 400 depending on my income. And
Yes. So,
his son, I think, has 40 IQ.
okay. So yes, if there is under, I believe it's under 60. I don't know for sure. Don't quote me on that. But what I will tell you to do is that, and yes, if you have two children with a disability, you would get that twice. It's for each child. That service is for each child. But I will tell you that when you fill out the application, you actually do not have to include the diagnosis at that time. All you have to do is fill out a very short application, and I'm happy to email that to you if you provide your let us know if you need that application and I can send it to you. But all you have to do is actually fill out a very short application along with a copy of your social security card and the child's birth certificate. And all you have to do is email it. And then they actually will get you on the waiting list. And when your name comes up to the top of that list, they will go and do an evaluation, and the state will pay for that evaluation. Okay. So that's something you do not have to worry about getting all that diagnostic information in order to get on the waiting list. I hope that answered your question. And if you put your information, we will make sure and get you that application, and I can call you and answer some more questions about that. Okay. So the next one we're going to do, let's see. Don't know why sometimes it advances and sometimes it doesn't. Let's see. Okay, we're just going to wait just a second. Maybe I tell you, I laugh because I literally have been doing the exact same thing and just pressing the arrow, and now the arrow's not doing anything. So, hold on just a second. Oh, the joys of technology, the joys of technology. Why would the arrow be working? Hold on just a second, guys. Okay, don't know what. All of a sudden it just stops working. We were on such a roll. We were doing so good. Okay, I'm going to just stop sharing for a minute and we're going to just share it again to see if that will help a little bit.
Okay, Kevin Jimenez has another question.
Okay, go ahead while we're doing this.
Is the school IAP and psychology evaluation not enough?
So what you need to do is they have to do the evaluation themselves. So yes, you can put include an evaluation with the application, but they're going to have you do another one anyway. So I would include what you want, but once your name comes up on that list, they will actually contact you and send you to a state evaluator. hopefully that answered that one. Okay, education and transition resources. I got it to work. I guess all I had to do was start it over. So basically, this one, Oklahoma Parent Center. Hopefully, everybody can see this one working okay. It's a statewide school resources for children. They have a wonderful website. This helps with IEP. They do lots of information. They do quarterly newsletters, and you can email them, you can call them. But I promise you, if you go to oklahomaparentcenter.org, you will see so much information about IEPs. They actually have YouTube videos and information about 504 plans. They actually have letters that are already created that you can use as a template for, like, maybe you don't agree with the school's the way that they're handling things. You could then reach out to them, and they have templates of letters that you can use. So the Oklahoma Parent Center is just a fabulous resource that we hope you can take advantage of, and they are statewide. So another one, if you live in the eastern Oklahoma and you have care for a loved one with autism or other disabilities, the Pervasive Parenting Center is Adar, Cherokee, LaFleur, Sequoia, Haskell, and Latimer counties. And I tell you what, they are phenomenal. They partner with the Department of Education. They do IEP, they do peer mentoring, they have a resource center. They have all kinds of stuff. So make sure if you live in that eastern part of Oklahoma that you have connected with a Pervasive Parenting Center. It's a wonderful resource. Okay, so the next one, this is with the trainings that the special education department does. I actually didn't realize how many trainings the special education department does of Oklahoma, but some of the ones that they do, they have a special education parent handbook. You'll also see information about the Lindsay Nicole Henry Scholarship. If you have an individual with a disability and you don't want them to go to public school, you actually can get state money that can be used as a scholarship to attend a private school. That's called the Lindsay Nicole Henry Scholarship. If you go to the special education website, you will actually see the parent handbook. You'll see all the information about family resources, and you'll get more information about the Lindsay Nicole Scholarship. Again, that's for if you want your child to go to a private school instead of a public school, and they have a learning disability. Okay, next one. So rights law. This is one of my favorites. And we actually just got the dates for the Rights Law Conference. It's going to be in the fall. There's, I believe, one in Oklahoma City, and there's going to be one in December. I will actually, when I send out this presentation, I will actually include the flyer for the Rights Law Conference. If you notice Rights Law, make sure if you Google it, that it starts with a W. And this is a one-day special education conference for parents and for professionals. I will tell you, my daughter, she's 23, she has Down syndrome, so I bring some lived experience to this conversation. And I've actually attended a couple, but my first Rights Law I did when she was in kindergarten. And I can't tell you enough how much it helped me. It helped me understand the difference and what my rights were as a parent. If you're a professional and you work with families that have IEPs or on 504 plans, you as a professional could attend this conference so you can learn the tools and strategies so you could explain it to the families that you serve. But the rights law, I'll tell you, you get some free handbooks, and he talks all about the rights and ways to go about education and advocacy. So the next one, if you know about this one, is the Special Education Resolution Center. A lot of people don't know about this one. The Special Education Resolution Center, they are the ones that if you are having a hard time, maybe with your school system, and you don't really, there's a disability law center that we'll talk about, but they will actually, they're different than the disability law center in the fact that the resolution center, they basically act as they do a lot of due process hearings, and they try to settle disputes at the beginning. A lot of times, if the resolution center can't handle it, then the disability law center will actually get involved. But just know that if you are having trouble with the school system or you feel that your rights aren't being heard or followed, you can contact the Special Education Resolution Center and they can help with that and kind of walk you along that path. We refer a lot of families to the center. Okay, next one. So if you, this one, the transition resources, this is DRS, the Oklahoma Rehabilitation Services. This is something that this is for transition aged youth. So this would be after the age of 18. And one of the things that we talk about here is they do vocational counseling and guidance, school work study, on-the-job training, supported employment, job development and placement. So what we do is, again, this is DRS, Department of Rehabilitation Services. They are part of Oklahoma Rehabilitation Services. So if all you need to do to get to them is just put, if you type in Oklahoma Rehabilitation Services, and you can type in transition or post-secondary, you will actually get all of this information. What I recommend doing is you cannot sign up for DRS, I believe, until you're 15 and a half. It might be 15, but I believe it's 15 and a half is when you can fill out an application to get services for DRS. This is where the child free can get a job coach, they can get some job training, and they are assigned a case, like a case manager or kind of like a vocational counseling trainer. I apologize, not a case manager, but a vocational trainer that will help them through their process. And again, this is with DRS. The next one is Able Tech. Able Tech, I can't, Able Tech is statewide. They're located in Stillwater, but it actually is all about assistive technology. They literally have pins, furniture, and kitchen appliances to talk about text to speech. It's anything that's adaptive technology, screen enlargers, robotic vision. They have a device loan program. They can repair and exchange different technology pieces. One of the things I used Able Tech for is my daughter was having, she has Down syndrome regression disorder, and so she lost the ability to communicate and using her words. So we actually got a communication device that we were able to borrow from Able Tech. We got it on loaner for 6 weeks, and then we were actually able to extend it. But during that time, we worked with our speech therapist to see if it would actually work. And we learned what devices on that communication device would work and if it would even be able, that way we could get it approved by insurance. So this is something that if you need any type of adaptive technology, again, they have a reuse program. They have a funding guide. So if you need something that's assistive technology and you're trying to purchase something, they actually have ways that they'll teach you about how to fund it, and different grants that are out there. So again, that is Able Tech here in Oklahoma. Now we're going to kind of move into the legal and advocacy resources. So we're kind of transitioning. Those were the education type services. Now the legal and advocacy. The one I talked to you about is Oklahoma Disability Law Center. This is free legal advice, and it is one of the ones that like I said, if you reached out to the Special Education Resolution Center and they weren't able to come to a mutual collaboration with the school and your family, and things were getting a little bit, I would say, more tense, then that case would be, you could call the Oklahoma Disability Law Center, and then they could help you with some of those legal services. There's no charge for this, but they do take the cases kind of on a case-to-case basis. So what you would do is you'd reach out to them, they'll do a phone intake, you'll tell them a little bit about what's going on, and then they'll decide whether or not that's a case that they want to take on. So good resource. There's also the Oklahoma Disability Concerns. This one is located in Oklahoma City, but it is statewide. The Office of Disability Concerns, it basically has the ability to identify the needs of people with disabilities on a continuing basis and to serve as a referral and information source for people with disabilities seeking services in the provision. So if you have questions about disabilities, you can actually contact the Oklahoma Disability Concerns and they will actually help you with some navigation. This has a lot of information with referrals and advocacy. So they're very, very good at representing the concerns that you might have within our state. I feel like this is an underutilized service, and we really need to make sure that we contact them and utilize them more as we express our concerns. Okay, the next one is Developmental Disabilities Council of Oklahoma. This one has several things on this. This is a wonderful resource. It's kind of a hidden gem. There's something called the Youth Leadership Forum. The Youth Leadership Forum is a program where they take high school juniors and seniors with disabilities, and they every year they get to go to OU, I believe, and they go for a week, and they attend a leadership type camp. This is called the Youth Leadership Forum, and that is all under the Developmental Disabilities Council of Oklahoma. So you can reach out to them and tell them you want more information and that you have a child that is in junior or senior year with a disability, and they can, that is free of charge according to funding. It all kind of depends on funding. Another thing is called partners in policy making. Partners in policy making is where you as a caregiver or as a professional, you can actually attend. I believe it's a 9-month, it's for 9 months. It usually starts in the fall and ends in May, and they have a graduation type ceremony. And what it is that you actually every month, 1 weekend a month on a Friday night up into a Saturday, you would go to Oklahoma City and they actually provide you with respite, or I'm sorry, with the hotel and transportation, and you attend a training. It's a Friday night, all day Saturday, and you work together with other people in the community about advocacy and knowing how to partner. It has been going on for so long, and this is the way that we've been able to train our advocates to become community leaders. And again, that's called Partners in Policy Making. And this is all under that Disabilities Council. Another thing they have is the Justin A. McCurry Library and Resource Center, where you can check out books. So that's something that maybe there's a book that you're wanting to look at that doesn't have it at the library. Maybe the council would have it as well. The Arc of Oklahoma.
Erin,
Even though,
we
yes,
have another
yes,
we have another question from
okay,
Kevin
thank you.
Jimenez. Can
Okay.
Oklahoma Disabilities Law Center help with Social Security claim? Is the denied to pay to child with a multiple disabilities?
Okay, thank you very much. So what I do is I would contact them and ask them, and then what they'll do is they'll take that, they'll look at the information, but then what's really great about them is if they can't help you and answer their questions, they will then tell you and refer you to who can help you with that question. So that is a really, I'm glad you brought that up. So I would absolutely contact them, and then if they deny the case and they say we can't help you, they at least they'll tell you who they recommend. Good question. Thank you. So the Arc of Oklahoma, it is located in Tulsa. However, it is statewide. So they have resources across the state. Their website, the arcok.org, go to that. They have a lot of self-advocacy training. They also do parent training. They have a support group. They do a lot of stuff with the autism community. They used to do, and it kind of depends on funding and their schedules at the time, but they did a lot of social groups for individuals with autism. They also are doing a training for IEPs as well. They have partnered with Oklahoma Parent Center and a lot of other organizations, and they actually will provide a peer mentor as you're going through the IEP process. So the Arc of Oklahoma is a very good resource for mental health and for disabilities. Sooner Success. We partner with Sooner Success all the time. Sooner Success is like us in the fact that they do resource navigation. They also, though, do a lot with SIB shops. Nancy herself is partners with Sooner Success and Creoaks to offer SIB shops because we don't want to forget the SIBs. When you have a child with a behavioral health challenge or a special need, they get a lot of attention. So we want to make sure that all of the family is supported and really do that family-centered care. So we have what we call SIB shops, and that is where the sibling of the child with the mental health challenge or disability gets to have a day for themselves. And during that, they're able to connect with other families and other siblings that are going through similar situations. I know when my son went through SIB shops, he was so excited that he met another kid that said that sometimes his sister threw fits in Walmart. And he was, Mom, so his sister, she throws fits in Walmart too. And he just thought that was the coolest thing ever. But that was what he needed at that time. So it can be a really, really good help to those siblings. I also want to say that Sooner Success does a lot with respite. They also do a lot with formula, like if there's a special formula that you're looking for, sometimes they can help with some grants that they have to get that paid for. So they're just another really good resource. And again, they are statewide. This is us. So we can't forget to put us in the community resource page, which I'll get a little bit more to us. But again, you know, if you go to our website, which I hope you've been able to look at, it's basically broken down into 3 buckets. We have that emotional support with that peer-to-peer mentoring where we can help you walk alongside you with a diagnosis or just a behavioral health challenge. We also provide those trainings like I talked about. We do care notebook trainings. If you go to our website, again, that's oklahomafamilynetwork.org, and you go to care notebook training, we have all of our documents that are inside of our care notebook. And inside of our care notebook, there's a medication management page. There is a behavior log. There's a seizure log. There's how to take care of me. There's a portable medical summary. There's a vaccination page. All of that is included in our care notebooks. And all you do, go to our website, click on care notebook training. All of those documents are available for you to print off. One of the other ones we do is we will go to the hospital and do hospital visitations. We also have a podcast that I'll talk about in a little bit. We have a YouTube channel. We do virtual yoga every Thursday to talk about deep breathing and the power of being centered and grounded in meditation. And we have Toolbox Tuesdays once a month that provides a different organization that provides resources. We do monthly mental health presentations like this one every single month. We're forming we do a lot of family and youth leadership trainings, and we do support groups across the state. So that's just a little bit about what we do, but I hope you take time to really go over our website. We have a ton of information and resources on our website. The next one, the Oklahoma Family Support 360 Center. This is actually a part of the Center for Learning and Leadership that we talked about at the beginning of this presentation that has that really good guide, but they assist families of children with developmental disabilities who are Medicaid eligible. They primarily serve Spanish-speaking and African-American families by navigating the systems. You will work with a family support coordinator. They do training to pediatric interns, lots of work for mental health and developmental disabilities. But again, that's the Oklahoma Family Support 360 Center. A lot of people don't know about that resource. Another resource a lot of people don't know about is Oklahoma People First. So this is an agency that is actually run for and by people with disabilities. Nothing about us without us. I absolutely love that motto that they have. But again, you can go to their Facebook page, OK People First. They have a great Facebook page and lots of information. And again, that is for basically young adults that are wanting to get involved in the community that have developmental disabilities to have their voice shared. They do a lot of advocacy work. Okay, now we're going to kind of move in to the disability specific resources. So this is one, if you have a child or you have our professional serving families that have a diagnosis of autism or think that they have a diagnosis of autism, this is where you can provide screenings, you can get all kinds of information. autismokc.org or the Oklahoma Autism Center. Um, Actually, I will tell you the Oklahoma, I think on this slide, it says autismokc.org, but it's actually autismoklahoma.org. So I apologize for that. But what it is on this one is both of them serve different stuff. So there's the Oklahoma Autism Center, there's the Oklahoma Autism Network, and then they have Autism Oklahoma. All of them do different things. But one thing I really, really recommend you doing is going to the Oklahoma Autism Network has a provider page. I cannot speak strongly enough about how helpful this provider directory can be. On the Oklahoma Autism Network, you can actually go to that. All you have to do is put in Oklahoma Autism Network provider page and it'll pop up. But what it does is it asks you what, I believe it asks you what your zip code is, what age you're referencing, and the different topics that you want information about. And then it will kick back out the providers that fit that description and those specific needs that you're looking for. So that provider directory, they try to keep it updated, but it will talk about who does ABA therapy, who maybe some good doctors that serve individuals with autism. It talks about even adults, and then it also has school age children as well. So that provider directory is very important. I really strongly recommend you getting on both of their newsletter list. I'm subscribed to both of their newsletters and also their Facebook pages. They do a lot of social gatherings for young adults and children with autism. So you don't know what you don't know. So make sure you subscribe to those newsletters so that way you get the most up-to-date information, because a lot of times you can get, and they have like sensory Santas and sensory Easter egg hunts, and they'll post all of that on their pages. So that can be very, very helpful. So the next one is if you have a child or working with a family that has a child with Down syndrome, first of all, I'd love to talk to them because my daughter has Down syndrome and I'm very passionate about doing that. But there's the Down Syndrome Association of Tulsa, and then there's the Down Syndrome Association of Central Oklahoma. Both of them are support groups. There's two of them in Oklahoma. So basically, DSAT does the Tulsa and surrounding areas. Oklahoma City and those surrounding areas are with DASCO is what they call it. But again, this is for individuals that have Down syndrome or they're in their families. Very, very helpful. They do a buddy walk each year. They have social groups, all kinds of information. Next one is the Epilepsy Foundation. A lot of people do not realize that they actually will come to the school and teach other teachers and other kids about having seizures. So I have a mom that utilized them and said it was one of the best things she's ever done. They have a national conference. They talk about access to medication, finding a doctor who specializes in epilepsy. So if you know someone that has seizures, they don't even necessarily have to have epilepsy. I've sent a lot of families that have children that have seizures to the Epilepsy Foundation, and they've been able to help them and get them some referrals that they needed. So it's a really good, helpful resource. So the next one, systems of care. This is one that Nancy and I are very involved with. The city of Tulsa actually has a grant right now that we're trying to work on systematic change with systems of care. Systems of care is actually everything that is involved in the treatment of youth and children within the mental health field. So if you put in systems of care, Oklahoma, this will come up, but they have something called wraparound that I want to make sure and talk about. If your child has complex mental health needs, they have different behavioral health agencies in Tulsa and Oklahoma City have what they call wraparound. Think about that as wrapping your family with a hug. They will actually provide a case manager that will come to your home, and they will come in and they basically make sure that all the needs of the family are being met. Let's say that you're having trouble finding transportation to appointments, or you're having trouble getting to therapy. Having someone come to your home and talk about all of the services is part of what they call the wraparound process. So I will just tell you in Tulsa, for example, Creoaks, Counseling and Recovery, Family and Children's Services, Grand Mental Health, all of them, Dayspring, they provide wraparound services. And again, that is just part of systems of care for children that have complex mental health needs. The next one is if your child has a genetic disorder, there's something called the Heartland Regional Genetics Network. What this does is it ensures that the best possible outcomes happen for the child. We can actually get you connected to Heartland. This is something that I want to make sure I connect you to the right person. So if you do have someone that you know that has a genetic condition, we would make sure that we connected you to the right family support provider. There's also a support group that one of our coworkers does that is for undiagnosed. So maybe you have someone with a disability that doesn't have a mental health diagnosis. They don't have autism. They don't have Down syndrome. They don't have cerebral palsy, but they have an intellectual disability or mental health condition, but you don't know where it came from. Maybe we can connect you to someone in that genetics network. And we also have a Facebook page for those families so they can connect together. Another
So,
one we
Erin,
have,
tenemos
yes,
more questions since
yes,
um,
go ahead.
Kevin Jimenez, he said, I applied for partners. I am asking for them to pay for my transportation, and I will be happy to have hotel too. I did not have a response from them about
Oh,
transportation. Thank you for telling me about the hotel. Do you have the information writing about the hotel and transportation?
perfect. So yes, that is the partners in policy making. What I'm going to do is if you'll make sure and put your information in the chat, I will connect you with Jen Randall. She is the one that answers all those questions. She directs that program. So I'll make sure that you are put in touch with her because I really don't know the specifics of that. So we'll make sure and get you connected to her and get those questions answered.
Okay, another question is because my son is 16 with disabilities, can I apply for disabilities permit to park in a signed place on parking lot, or do I have to pay for that permit? He can walk.
Um, and make sure I understand that question that you're wondering if, can you say that again, Nancy? I'm sorry, I didn't understand that what they're wanting, or if the person that asked that question wants to come off, um, unmute themselves and tell me a little bit more.
Kevin, can you?
And that's okay. What I might do
Okay,
is if
that
you want,
it is because my son is 16 with disabilities, can apply for disabilities permit to park in a silent place
oh,
or parking lot, or do I
gotcha.
have to pay for that permit?
Gotcha. Okay. Yes, I understand now. So like an accessible parking sticker like that hangs on your dashboard. I got it now. Thank you. Thank you for explaining that. Sorry, Nancy. So I am going to look for that and I'll make sure I will answer you directly because I don't want to answer you wrong. I actually had to apply, but I had to go through my doctor. My doctor was the one that helped me get that. So what you need, but yes, you can absolutely get one. I don't know for sure if they've changed the price, but if you ask your doctor that you would like to get a accessible parking or handicap stickers, what another word, I hate that word that they use, but that's what it is. But accessible parking or disability sticker, there is, all you have to do is get your doctor to write basically something about it. And then I had to mail my letter into Oklahoma City to a certain department. But if you would, Nancy, make sure and get their information, tell them that I'll follow up with them and I'll make sure I get them that correct information.
Okay.
Thank you so much. And we'll make sure we get that. Okay, so the next one moving along is our NEST program. This is what I kind of told you at the beginning, where we help the families in the neonatal intensive care unit. Again, we do that grief support. We talk about we have talk about those special healthcare needs, but then we don't just support them in the NICU, we support them as they go home as well. So we just wanted to say that that's called our NEST program. So that's just one of the many things that we do at Oklahoma Family Network. Another one we do is we help families fighting childhood cancer. If you know of a family that has their child that's been diagnosed with cancer, or you are helping a family, please let us know. They do parenting, they do a retreat. She has a support group. She does caregiving training, wish programs, community events, support groups. So anyone that's been touched with childhood cancer, we can absolutely provide resources for. The Children's Behavioral Health Network, actually Oklahoma Family Network, we partner along with the Evolution Foundation and Parents Helping Parents. We all three are part of the Children's Behavioral Health Network. Parents Helping Parents. This is for families that have children that have substance abuse or addiction issues. So again, if you are caring for a young child or an older child and they have substance abuse issues, Parents Helping Parents is a national program, but we have a great program here in Oklahoma. They have support groups, they do Zoom meetings, and they can get you connected with tons of resources. I've actually spoken to them because I am a sibling of addiction. And one of those things that we talked about was getting involved and getting the support that you need. So that's a great organization. The Evolution Foundation, they actually can get you connected to getting involved within the community with different coalitions. So if you just Google Evolution Foundation, you will come up with their website, and they have all the ways that you can get connected to different coalitions across the state. This one right here, if you have anyone that has early hearing detection, we have an entire staff that is devoted to deaf and hard of hearing. So please know that if you have a baby that did not pass newborn screening, you know someone that is deaf or hard of hearing, we will absolutely connect you with that staff member, and she will get you connected with every resource you can think of. She has so many resources about how to get hearing aids paid for, about who to talk to, about getting them maybe at a cheaper rate. So please connect with us and we can get you connected to that resource. Next one is just some helpful phone numbers. The Sooner Care Helpline is right here, the warm line. Sooner Ride. Sooner Ride is something that I hope everybody knows about, but if you are on Sooner Care or Sooner Select, which OK Complete Health, Humana, or Aetna, any of those, Sooner Select or Sooner Care, you can actually call the Sooner Ride number, and they will pick you up and they will take you to your doctor's appointments. So that is something that is part of Medicaid and the Sooner Ride program. So Sooner Ride is something, again, if you need more information about that, I will give it to you. You can also just Google Oklahoma Sooner Ride. or call the number that's on the screen. And again, that is to provide transportation. They can pick you up and they can take you home from your doctor's appointments if you do have Sooner Care. The mental health crisis number is 988. If you text or call 988 from your phone, you can be connected to a mental health resource person. So they will answer the phone. You can, it's kind of like they do, it's like a suicide prevention hotline number as well. Again, you can text or call if you have a mental health crisis where you don't want to call 911 because you know that you don't want the police or fire to come, but you need help. And so I will tell you that if you text or call 988 and they feel that it is a serious situation that they need to call 911, they will. But they will also connect you to mental health providers that are in your area that can get you the resources or help you need. I had one family that called 988 and their child was having a complete uh, episode of rage and was starting to harm himself and others. And they were able to call COPES, and COPES came out instead of having the police call out. Because a lot of times in mental health situations, when 911 is called and the police come out, sometimes that escalates the child or the individual. So by calling 988, it's eliminating 911 and that situation to possibly escalate. So again, make sure you know 988 is the number to call. Another one that I want to just say is before we kind of transition into our calming down strategies is there's many more in the resource guide, but what we always talk about is network, network, network. Please don't box yourself into a diagnosis. When I say that, the reason why we say that, my daughter, like I said, has Down syndrome, but she has so many sensory needs. So a lot of times I go to the Autism Foundation because a lot of their resources can help my daughter who has Down syndrome. So sometimes, again, don't just go to the Down Syndrome Association or the Autism Foundation if they have a diagnosis of autism. You can go to the Autism Network or the Autism Foundation if you need information about maybe getting screening or you need information about behaviors. Another thing is don't just call the Epilepsy Foundation if you have epilepsy. You can call them if you have seizures. So that's what we kind of try to mean. Try to make sure you really network and you Google research, call us. There's so many resources that are available out there. So I'm going to skip over this. This is just our evaluation training. Some other resources I already talked to you about the NEST, the NICU prenatal diagnosis. I've talked to you about the Families Fighting Childhood Cancer. I wanted to briefly talk about, we have a group called Cultivating Connections. That is that parent to parent conversation about oncology and hematology. That's the support group for that community. I also told you a little bit about how we have virtual yoga every Thursday from 12 to 12:30. You can register. You just go to our website or you can use the QR code that is on the screen and you can do virtual yoga. You can turn on your camera, you can turn off your camera. It just depends on we have schools join us, we have professionals, we have homeschooler moms join us, whoever you want. And again, that's just every Thursday from 12 to 12:30. We have a podcast. Our podcast is called We Saved You a Seat. The QR code is up here. We have probably about 100 stories of inspiration and encouragement, and they're broken down into different categories. So there's substance abuse, there's autism, there's Down syndrome, there's challenging behaviors, there's different genetic conditions. They're all broken down into different categories. So again, you can just look at We Saved You a Seat, and it's available for you. We love it because you can listen to it on the way to work. You can listen to it late at night, just to provide you and make you feel not alone. Because that's truly our number one job at Oklahoma Family Network, is to make sure that you don't feel alone and that you have the resources and support that you need. We have a YouTube channel. I love our YouTube channel. actually this recording, after we edit it, it will go on our YouTube channel. So if you just Google Oklahoma Family Network YouTube, or you can subscribe to our channel, we have all of our past recordings, like helping the anxious child, dealing with anger in the family, creative consequences, active listening, the 5 love languages of children. Those are just a couple that are on our YouTube channel. And if you listen to one of our YouTube channels, or listen to one of our YouTube episodes and it really resonates with you, all you have to do is shoot me an email and I'll send you the presentation, because the presenter puts a lot of links, active links inside of her presentations. So I would be more than happy to send you that presentation that includes the links along with all the handouts that go along with that presentation. So again, if you listen to one of our on our YouTube channels, just email me and I'll send you all that information. Our Toolbox Tuesdays, we have on our website. The next one, I believe, is August 12th, maybe, I can't remember. And what this is truly just a, every single Tuesday, we talk about the different professional agencies, and we kind of do a professional highlight. We also want to talk about our monthly mental health presentations. Next month, I'll send you a flyer for August. We are doing life course tools, which talks about the trajectory towards a good life. Lifecoursetools.org, great website. We're also going to make hope rings, which are like mini scrapbooks. And I'm going to mail you all the supplies to make a scrapbook. So that's something we can do. Okay, I know I'm going to hurry because I don't want to keep you. So if you have questions, put them in the chat and I'll wait till at the end to answer any, just because for the sake of time. So now I'm going to kind of transition very abruptly. There's no way to kind of just ease into this, but we wanted to give you some strategies along with some resources. So tonight I'm going to give you, for the next 15 minutes, a couple calm down strategies that we can talk about. The first one we do is, you've probably seen, hopefully, if you've been around with Oklahoma Family Network, we talk about calming water bottles. We actually have this presentation on our YouTube channel. And if you go to our YouTube channel and you put in calming water bottle, you can look at our presentation. And what we do is we talk about self-regulation. We talk about how we can refocus and ground ourselves, about sensory needs, how to play I Spy with your calming water bottle. This is how you do it. You get a water bottle, you get some of the Orbeez, which are like water beads, you get your glitter, and you get the focus pieces. And what we do is we make this water bottle and we talk about how you can refocus and you can use your energy by finding those focus pieces inside of your water bottle. Again, if you want me to mail you the supplies to do one, I would be happy to do that. We did one last month, so occasionally we'll do them over Zoom. But again, you can watch it on the YouTube and I can help you with supplies. But all you need is water beads, glitter, and focus pieces, and a water bottle. And that's a really good activity that you can do with your kids for a calm down strategy. Another thing that we do is the hope rings that I told you we're going to be making in August. It is truly just a mini scrapbook. It's something that it can refocus some of that anxiety and that anxiousness that a child or an adult might have. So what we do is we put personal photos, we tie ribbons, we document our life events, we put quotes, maybe scripture, but we put things, it's kind of like, it's a way to refocus and de-stress. So it's kind of like a stress ball, but it's on a ring with pictures to help us refocus. So we'll be creating those in August. But if you want more information about that, I can send you this. But here's an example of what it's going to look like, where you put the different pictures, and that can be very calming. Let's say a child is having attachment disorders, or we use them a lot in bereavement. Let's say that, or maybe post-traumatic stress. If you have something that makes you very anxious, you could maybe put like a quote or a picture of the beach or whatever makes you happy on this ring, and you could put it to your purse or your backpack. So that way you refocus that negative energy and you put it to something to kind of calm you down. So what we do is we have helping the anxious child. We partner with Lauren Alvarez. She is a school counselor, and what we do is she has a presentation called "Helping the Anxious Child," and that is actually on our YouTube channel. And some of the stuff that we go through, she talks about what is anxiety. And one thing I really wanted to stress when we talk about calm down strategies is please remember it isn't a behavior, it's a state of the brain. One thing she says all the time, every behavior is a form of communication. Please remember that. Every behavior is a form of communication. Like I said earlier, my daughter, she's mainly nonverbal. And for example, she was hitting her iPad the other day and she was hitting it over and over and she was pounding on it. And I really had to stop and say, instead of being like, don't hit your iPad, let's not do that. I have to kind of change my mindset. And that's really what it is. It's a change of a mindset. And I ask I looked and I said, how can I help? What can I do? And I looked and her iPad was out of batteries or out of charge. And she was trying to find the words to tell me that she needed her iPad charged. I actually could have looked at that. If I hadn't have thought about that, I would have just said, oh, she's getting angry. She's pounding on her iPad. She's throwing a fit. But no, she was trying to say something. She was trying to communicate it, but she didn't have the words. So it isn't a behavior, it's a state of the brain. And every behavior is a form of communication. With that, you can always get these on Amazon. As you know, you can get water beads, you can get stress balls, you can get the fidget like the poppets. All of those are really good for helping kids and adults. I promise you, Nancy, my coworker, will tell you when I get really anxious, I actually have a stress ball in my pocket. And when I just need to take like a breather and I'm getting really overwhelmed, I will actually squeeze my stress ball in like my sweater or my blazer or whatever, just because it kind of releases some of that tension. Another thing is like we talk about like squeezing the orange. We talk about the 5, 4, 3, 2, 1. We'll talk about here in a minute. But another thing you can do is create a calm space. Create a space that you can go to or your child can go to. We actually have a hanging swing in my daughter's room that has a pillow, and that is where we say when you start to get anxious, where do we go? But you have to model that behavior. You can't just expect them to know that. You have to model it, and it might take a lot of times. You might have to say, okay, where do we go when we get anxious? Where do we go? When my daughter gets really anxious, I get a stress ball or a fidget toy and I put it in her hand. I say, let's squeeze our fidget toy. Let's squeeze our fidget toy. Let's squeeze our fidget toy. It took a lot of times and a lot of repetition. But when she started getting anxious, I noticed she would open the drawer to get her calm down toy, her fidget toy. It took a lot of repetition, but she got there. So again, don't give up. It takes a lot of time, but we have to model those behaviors. So we talk about how many adults minimize sensory toys, but it's kind of like a remote control. You want to change the channel or change my mood by doing things on purpose to change the mood. So those are some things you can do. If you think about how calming strategies are like a remote control for changing the channel of your brain. I feel like that's a really good visual and it really helps you realize that these aren't just toys. They're the remote control to change the way your brain works. So I'm going to go over these pretty quickly for the sake of time, but we can talk about mood meters. So you can check in with your child, even in a nonverbal way. When I know how you feel, I can be better at helping you. So you can say, feelings are okay. There isn't a bad feeling, it just is. What we do with that feeling is makes a difference. What can you do for yourself to move you from angry to calm? What can I do to help you to move from sad to happy? So here's a mood meter. All you have to do is Google mood meter and you will get templates. But when you do this, what I recommend is talking to your child about what are things or words that describe angry? What are words that describe sad, happy, calm? And then that way you can make sure that they understand what words describe that feeling. But it's called a mood meter. It can be very, very helpful to talk about ways about regulation. Another thing you can do is you can write it out. This is a really good one. When you write it out, you can write it and then you can throw it away. You can journal about your worries. I love this. Make a worry box, right? So you can write down all your worries. And then when they get mad, they can wrinkle it up and you can say, you know what? We're going to throw away this worry. We're not going to talk about it. You can get a portable mini shredder. You can actually get them on Amazon. And that way, when they have worries, they can write it out and they can put it in a portable shredder. That's a really cool way to do it. Understand what worry is. What you can do is you can read books and social stories about worry. There's also the movie Inside Out or Inside Out 2. They talk about the different emotions. I know it's just a movie, but it can be very, very helpful when describing the different emotions. All you have to do is put Google social stories, worry, and you will get a ton of social stories that pop up about that. Social stories are basically things that they talk about the different situations that a child might encounter with that emotion. I love this one. Have a debate with yourself. So this is really good. There's some worksheets that I can send you guys and some fact checking thoughts. But I love this when you think about personify worry, think about it like a character. Okay. So we tell our kids, what is worry like? And we're going to talk about it. Make sure I love it when someone says, you know what, I see that you're feeling very worried. Give it a name. That's what that means. Give it a name. Oops. Another one. This one is really good. This one, whoops, sorry about that. This one is self-soothing. Give yourself a hug. Rub your ears, hold your own hand, calm down with lotion. I didn't ever used to remember this one. Smelling chapstick, that can be really, really good. Mindfulness, breathing techniques like that virtual yoga that we do. You can use your body. Help redirect your child by playing catch, take a walk, listening to music, do some jumping jacks. This is a really good one too. Push against a wall. That's a good one. That using your body to calm yourself down. Another one is practice chopping wood. This one can redirect. Facial tapping. This is where you just touch on different parts of your face. Yoga ball. You can get a yoga ball and roll on it. That's using your body to help calm down. Another one I wanted to mention that I don't think is on here is the 5, 4, 3, 2, 1. And I'm actually going to send you this in the presentation. I'll send you several different calm down strategies. But what you can do on 5, 4, 3, 2, 1 is you say 5 things you can smell, 4 things, use your 5 senses, but it helps redirect. You look at your child when they're getting ready to have a meltdown and you say, oh, wait, stop. We're going to refocus. I want you to tell me 5 things you can see. And then they have to look around and find 5 things you can see. I want you to tell me 4 things you can smell. It doesn't have to be right around you, but okay, I smell chocolate chip cookies. I can smell an apple pie. I can smell, chapstick. 4 things. Use 3 things you can hear. And then they'd say, oh, the birds. I can hear crickets, whatever. 2 things you can, I just went blank on my senses. You can touch. So you go down and all that is doing is it's regulating, refocusing your brain. Disconnect to reconnect. Walk in nature. I love this one. Do a technology detox. Take away all technology. Befriend water. I can't stress enough that take a cold bath, hot bath, or shower. Sometimes when my daughter has a complete meltdown, let's go take a hot bath. It does something. I turn on some relaxing music and it can really help calm down. This is another one. This one, practice mindfulness. Again, the brain is remote control and you can change the channel. Mindfulness is moment to moment awareness of one's thoughts without judgment. So think of that. You can blow bubbles. You can do this with a straw in a glass of milk or water, blow bubbles. You could have family floor time. Everyone sits or lies together for 15 minutes at the end of the day. Set a timer and just let everyone take deep breaths and lay on the floor and be silly. Listen to stories, listen to music, listen to guided meditations. Oh, I apologize. I got ahead of myself. If you notice, this says take 5, hear, see, smell, feel, and taste. So that's that 5, 4, 3, 2, 1 that I was just talking about. Listen to music, listen to stories. Again, listen, help someone else. This, I know it seems silly, but you help by helping someone else, you actually help yourself more. So a lot of times, go say, you know what? Let's go plant some flowers for a neighbor. Again, this is getting them out of that meltdown and getting them to refocus. So now I went through this so quickly at the end, but I'm going to give you, I'm going to put my cell phone, the 918-724-8574, and you all have my email address. I really appreciate you taking the time to join us tonight. I hope that you learned something, hopefully a new resource that you didn't know about. And I also hope that you can take some of those calming strategies that I gave you and apply them. But I really hope that you can go to our YouTube channel and listen to the Helping the Anxious Child, the 5 Love Languages of Children, so you can get a better understanding of it. So thank you for joining us this evening, and I'm going to stop the recording. But then again, I will stay on if you have any questions. And again, thank you for joining us this evening.